Hi, my name is Allison Weiss, and this is my presentation on the adoption of electronic health records. So it's important to plan and carry out the integration of an EHR into an organization. It requires efforts from everyone in the organization, from housekeeping to physicians to the nurses and the providers and all the managers. It involves every unit and it has multiple moving factors. By properly implementing a new EHR, it can facilitate success in the organization. If the organization becomes prepared at the beginning, it can minimize delays and increase satisfaction with the new EHR later on. So step one is to tailor the system to meet the practice needs. So they should uncover inefficiencies that are already being experienced in the practice. They should assess the current workflow and current resources that they have to determine what needs redesigned and how they should go from there. They should assess workflow, data, and training needs and determine how many people they need and what the transition is going to look like. And by doing that, they can establish realistic expectations. So they can look at who is employed and who is already trained, and could they train other people? And is the transition to a new EHR or starting an electronic health record, is it realistic, and what are going to be the goals? And they should consider the pros, cons, function, usability, price, and safety of transitioning to a new electronic healthcare system. The next step is to establish a change management process. This is a process that takes a really long time. This is pretty much a year out in advance. Who is going to be on the team? Who is going to be the chain of command? Who's going to be the person that is responsible for the transition? Who's going to be the person to answer the questions when things go wrong? Establishing these people and getting ready for the change is prepared very early on before the rest of the organization might even know that there's going to be a change. So they need to develop a plan, and they need to prepare for the system to fail and for the staff to have challenges. Beginning a new process in any healthcare setting is really hard, and they should prepare way in advance on what challenges that they're going to face during that process. They should prepare the team with a healthcare record team leader. Super users are people who are trained on how to use the EHR, or maybe they're from a nearby hospital and use the same charting system, or maybe they're within the same large organization and they use the same system. There's nurse leads and medical assistant leads and health unit coordinator leads. They're the person that the rest of the trainees can go to when they face challenges and encounter blocks in the road. And there's really just supposed to be a lead in each department who is the person that they can go to whenever they need help. And there's two types of phases. It can be a big bang phase or a phased rollout. A big bang is when everyone experiences the change at once, and that would be everyone accommodating to the new health record at the same time. This kind of rollout has less time maintaining the system, and you don't have to spend as much time using the old system. It reduces the amount of time needed for the transition, but it's a lot more stressful, and it has limited opportunities for system testing and to explore what went wrong. The phased rollout is when each department changes to the new health record slowly, and they would be able to identify barriers and problems they faced along the way rather than all at once, like in the Big Bang rollout. Big issues can be isolated to just that unit or department rather than everyone having to experience it. And it also utilizes the pay it forward approach. So people who have already gone through the training and their department has already changed to the new EHR can then train other departments and other managers and providers. The con with that one is that different units can be using different healthcare records and different systems. And it also can't predict all issues that would occur. So, step 3 is to determine how to backload patient medical histories. So, if a organization is transitioning from paper to electronic, what needs to be considered is scanning in the paper documentation. And it's important to consider that that is going to take some time and determine a timeline for scanning in the documents. It's also important to determine what exactly is going to be scanned in. Is that going to include all labs, imaging, and documentation? Will everything be scanned in or just certain years? Some places have only scanned in the past 3 or 5 years, whereas some places want to scan in every document that's existed for the patient. And how are medications, allergies, histories, and medical diagnoses going to be transferred to the new system? Is it going to be manually typed in? Is it just going to be added with new visits? How is that process going to look? It's also important to remember that patient data needs to remain secure during the whole process, and HIPAA still needs to be followed to protect patient information during the whole process. And step 4 is to account for the time that the staff needs to learn the new system. So most problems are identified in the first 2 to 8 weeks of launching a new healthcare system to the organization. And go live events are best completed during night shift or weekends whenever things are a little slower. Most places tend to do the transition, like I said, during night shift or on Saturdays or Sundays whenever there's less productivity. And sometimes it's important to have lower appointments and lower work days on the days whenever the transition would occur. And it's important to take note that you need to give grace to the people who are learning the new system and give them a lot of time to learn it and try to improve the errors and figure out what's working and not working for them. So I was actually a super user recently when a hospital in West Virginia transitioned to the electronic health record that I've been using at my hospital. And that experience helped me a lot when doing this presentation, especially for this slide, which is step 5, supporting the system. So kind of like being a super user, the system should have on-site trainers who are designated people to help with errors, difficulties, and barriers that the staff face while trying to navigate the new system. It could be people kind of like me who's from a nearby organization who use the same software, or if they use that phase rollout kind of technique of implementing the new software, those people can train more people. There could be on-site IT staff to help facilitate difficulties and be there to troubleshoot issues. There could be a hotline number to call and report issues. It could be someone like a super user or an IT person who can try to help answer questions and figure out what's working and what's delaying care. And online forms, kind of like safety reporting events, could be available to report if a safety event happened, if a patient was impacted, if documentation was impacted, if there was a delay of care, anything that happened that needs to be addressed and needs to be figured out could be reported electronically. The last step is step 6, and it's to encourage staff throughout the process. So a big thing is communication with the people early on in the process so they can anticipate the change and honestly even prepare themselves mentally, because it's really hard to adjust in the workplace to doing something new, especially something that regards patient care and documentation. So prepare them for what's coming. Attempt to decrease clinical volume during the go live if that's at all possible. Just decrease the amount of people that could be negatively impacted by the event. Provide extensive training and extensive amount of time for the new system. Be okay with a lower clinical productivity during the transition. Continuously solicit and respond to feedback and revisit the workflow even after the system's been fully integrated. Just because it was working last week doesn't mean they discovered things that weren't working well for them this week. Then analyze how the clinicians can use the EHR even after it's been fully integrated. Find out if the staff are using workarounds. Do they need more training, or do they need to adjust the workflow? Make sure that this is continuously being addressed weeks or even months after the program's been started. So the next step of the project was to compare and contrast three EHRs. So this slide is the contrast between three EHRs. So the first one I looked at was called Dr. Chrono. Its pros were that it was easily accessible. You could access it on a laptop, a tablet, and even a cell phone. And it's customizable for the providers so they can change the template of their notes, forms, and workflows to what is tailored to their population and what they need every day. And it has tools to help with billing, coding, and submitting claims electronically and tracking payments for the patient. It also helps the provider select ICD codes. It's available on Mac, Windows, and Android. NextGen has easily accessible SOAP notes and HPI templates, and the templates are easily adjustable to fit a specific workflow in a specific environment. It also has a voice-to-text function, so the provider can speak into the device and it'll generate their note. And it also has a mobile app that is easily accessible. It generates common orders based on what the provider is typing. And it has automated alerts for drug interactions, allergies, and dosage errors when the provider is calling in a prescription. And it's available on Mac, Windows, and Android. eClinicalWorks aids providers specifically in coding. For example, it'll notify the provider if they're entering a code regarding pregnancy on a male patient. It also aids in clustering codes. So if someone has a wellness visit, it'll include a heart check, a vision check, and a blood pressure check. And then you just type in one code for all of that. It also uses AI to aid in documentation and scheduling, but it's only available on Android and Windows. And Mac is a pretty big computer outlet that people use, so that could be kind of looked at as a con. So when comparing the three EHRs, all three of them help in some capacity with electronic prescribing, and some form of patient access is available, which significantly has improved patient satisfaction if they have a way of accessing their labs and imaging and scheduling via the internet. So that's important. Dr. Chrono and NextGen both have customizable templates to help the provider document, and they both can be adjusted to tailor the charting to their specific needs and what they like to use every day. Both Dr. Chrono and eClinicalWorks have features in assisting in coding and billing for their provider, which kind of creates more time for patient care rather than focusing all your time on coding and billing. Dr. ChronoCon is that canceling subscriptions can be challenging. There were long wait times reported on customer support, and sometimes the system glitched and the whole thing would crash, and it led to a slow navigation of using the chart. NextGen Con is that it had complex implementation and staff training. It was expensive to invest in the software and training, and because it was so user-friendly, it almost created a dependence on the technology because it helped so much in coding and billing that providers kind of reported they were a little bit dependent on it. So if it were to stop, there might be errors and issues with billing. And the eClinicalWorks cons are that it required significant training because it's such a complex coding system, and it sounds like once it's mastered, it's really great, but you really had to spend a lot of time learning how that coding worked. And the customer service was inconsistent, and it has limited customization for templates and workflows such as the SOAP note. And the lack of flexibility and customization created a lot of workarounds for the providers. So in my opinion and from the research, it sounds like the best EHR was NextGen. My rationale is that it was easily accessible for patients and they could look at their chart. Patient care was improved because the providers had easy access to their medical history, allergies, and test results. It streamlines workflow by aiding the provider in billing, scheduling, and documentation. And when less time is being spent on that, more time is being spent with the patient, which is ultimately what we care about. The medication safety was enhanced because it automatically was checking for benefits. It was automatically comparing prices. It automatically requests prior authorization from insurance when that medication is being sent to the pharmacy. And it also screens for allergies and dosage errors when the provider is prescribing a medication, which ultimately reduces adverse events. For ease of documentation, more time is being spent with the patient, and the provider can customize their templates for their progress notes, consent, and patient visits, and it can be tailored for each provider for their personal workflow. E-prescribing, they verify formulary coverage and benefits. Like I said, it initiates prior authorization, and it transmits prescriptions directly to the pharmacy. For order entry, order labs and diagnostics can be ordered directly from the patient chart, and common orders are generated based on what's being documented. And pre-built templates can be edited, and they can be tailored, like I said, to each provider's personal preference. What I learned is that implementing a new EHR has many difficulties and takes years of preparation and lots of moving parts and lots of people being involved. And each system definitely comes with its pros and cons. And I think the greatest benefits for providers would be to aid in prescribing, coding, and documentation. And understanding EHRs takes a lot of practice and time to master, so it's important to think about that. And the information helped me understand that EHRs are very helpful tools, but it's important to not become complacent with the EHR. It's great that it helps prevent med errors, and it's great that it notifies you of allergies, but you can't forget your basics and always check that. And here are my references, and so is the next slide, and thank you for listening.